Hello, everybody. I have a Remedial Pilates series for you for lower back. So, if you experience lower back pain quite frequently, this might be something to do every day or a couple times a week, including all the essentials to make your back feel stronger, more mobile, healthier, and less painful. Starting on all fours. Feel the hands underneath your shoulders, knees underneath your hips, and then go into a cat and cow stretch. This is a nice way to tune into your back, to tune into your spine and check in with mobility. And there might be days when there isn't that much mobility in the lower spine. If you have an episode of pain, you'll be smaller in that range of motion. So you want to stay gentle, not forcing anything, but definitely bring some circulation, some blood flow into those areas. Important also to mobilize the upper back, since a healthy upper back will support the lower back, make it less vulnerable to overuse. And then go into a twisted stretch. Same here, this might be smaller, or on a good day, you might be able to push a little further into a rotation. Other side. And then back onto all fours. Now tuck your toes under, and we're gonna go into ab activity, pulling the navel in, pelvic floor engaging, rib cage closing, and then try to lift your knees just an inch of the mat, hover them, and inhale down. Very gentle. Maybe your knees won't even leave the mat. Maybe you're only just thinking of releasing them. Exhaling, pulling the knees off with your abs. So think of the legs being lazy and the abs really doing all the work. Meanwhile, your shoulder blades are nice and wide, your neck is long. Lots of awareness in the core and in the stability of the lower back. So you don't want to let anything happen to that form that you decided for. It's not going to change as you lift your knees off. It's not going to change as you put them back down. If you feel good enough to stay up in the air, you can pulse your knees down now. Keep breathing through, working through that deep ab connection. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Now sit back into a child pose. Maybe the knees together will be your go-to place. You'll have more of a flexion if you do that. If you want to keep the lower back a little more straight, you might want to open your knees and just let the back sink in between your knees. And if this does too much, maybe your pelvis will just stay up and you'll rest your head down on the mat and you'll find a releasing situation here. Move on to your stomach now and have the arms next to you, the head down on the mat. Inhale and exhale, try to lift the upper body. If available, lift the legs too, making sure the thumbs are out, palms down, so you can really open the shoulders. An important exercise for the strength of your back extensors. Very gentle, since you're not moving dynamically through your spine. Squeezing your glutes at the same time, pulling your belly button off the mat, engaging the abs all the way through, exhaling. Four more. Three. Two. And one. And then take the hands underneath your forehead and just wiggle your pelvis right and left. And then turn onto one side, bending your knees in a right angle, heels aligned with your spine. And we're going to go into clams to work your glutes, external rotators and abductors, which are important for the stability of your pelvis and therefore for your back too. Open on the exhale, close on the inhale with the focus on stability of the pelvis. So keep that pelvic crust in place. Just find the mobility in the hip joint. At the same time, your transverse is active. So you want to almost think of pulling the pelvic crust together, those two sides. Navel pulling into your spine. Exhale. Inhale. Four more. And three. Two. And the last one. And release. Now turn onto your back. Find that sacrum connecting into the mat, shoulder blades, and the back of the head, the feet grounded. Inhale here, exhale, rolling up into a bridge. Try to go vertebra by vertebra, lengthen through your neck. Inhale at the top, and exhale, try to deepen the ab work, pulling them all the way in, vertebra by vertebra. Again, being mindful of the mobility that you have in this given situation. Apart from mobilizing your spine, you also want to work your glutes, the big glutes, gluteus maximus. You're working your hamstrings, you're lengthening through your quads, you're opening your hips, and you're working your core, pulling it in, working through that mobility, through that flexion. And we'll do one more here. And release. And then turn onto your other side. I'm going to show you my back. So you'll see the heels aligned with the spine. Inhaling here and exhale, go into the clam. Exhale, open. Inhale, close. Working your abs again. Transverse, pelvic floor. As much as this is about working the glutes, it really also is about stabilizing the spine, stabilizing the pelvis, not letting that rotation happen, and creating a lot of awareness doing that. So you want to feel the vertebrae staying in place, not moving away. And four more. 3. Exhaling on the opening, inhaling on the closing. 2 more. And last one. Release. Now turn back onto your back. Place yourself nicely, feeling the surface, connecting into the mat, having that air pocket underneath the small of your back. Inhale, and exhale, lift one foot just an inch off the mat now, and try to not alter your stability, alter your position at all. Inhale down, exhale, the other foot just lifting off the mat. And this is a very important exercise to tune into the deep core stability. As easy as it might look, if you do it right, you get in very deep and you create a lot of awareness and stability. So think of the foot that you're lifting being glued to the mat, or just being 100 pounds heavy. Anticipate with your exhale. So you want to exhale, pull the navel in and be ready before you lift that foot. And then you can only just deepen. And one more time on the left. And if this is too easy, feel free to tabletop your legs. Watch that transition to stay stable. And then work from the top. Exhale down, inhale up, exhale down, inhale up. And then pull your knees into your chest and let that lower back release. And maybe your lower back feels really happy to be in a flexion, to be curled in. Maybe not. If it doesn't feel happy, don't pull in too much and just keep that extension or neutral position in the lower back. Maybe this is the better place to be for right now. And then pull in one knee and extend the other leg. And see if your back wants to be twisted here. Coming back, switching legs, left leg pulling in. And over to the other side. And then this is a good way to also come up over your side. It's very friendly with a gentle back, a tender back. And then this is where we finish our remedial session. Bringing in all the healing energy. Deep inhale, palms together, down through your midline.